The following video is for educational purposes only. Please use this information with discretion. Our intent is to help you become a more informed healthcare consumer. Ortho University presents Adhesive Capsulitis, aka Frozen Shoulder, by Dr. David Eisenhauer. And now it's time to OrthoU.
Hello, I'm Dr. David Eisenhauer. I'm a board-certified and dual fellowship-trained orthopedic surgeon specializing in surgery of the shoulder, elbow, and hand. Today we're going to be discussing adhesive capsulitis, or frozen shoulder. What this is, how to diagnose it, and how to treat it. We'll give you some simple self-diagnostic tools as well as some simple home treatment remedies. First of all, what is adhesive capsulitis, or frozen shoulder? This is stiffening of the shoulder that is typically painful, at least in its initial stages. This is a somewhat poorly understood pathology. We don't always know why this occurs, but we know that it's more common in folks with diabetes and hypothyroidism, any other autoimmune diseases or reasons for inflammation in the body. Occasionally we'll see this after a surgery. Occasionally we'll see this after a relatively mild trauma. Essentially, this is scarring of the inferior joint capsule below the shoulder that causes stiffness and inability to lift the shoulder up and overhead. One of the telltale signs of adhesive capsulitis is inability to externally rotate the shoulder. We should be able to externally rotate to somewhere between 80 and 90 degrees. In patients with a frozen shoulder or adhesive capsulitis, oftentimes they're held up here at about 40 degrees or 20 degrees, or sometimes no external rotation at all. So for a self-diagnostic tool, look at yourself in front of the mirror and try to externally rotate your shoulders. If one hangs up about right here, and if it hangs up about right here, very likely you have an adhesive capsulitis. A frozen shoulder goes through three phases. The initial phase, where it's freezing, tends to be very painful, and the shoulder becomes increasingly stiff. The middle phase is a very stiff shoulder where the pain starts subsiding a little bit, and then the end phase is the thawing out phase where both the pain and the range of motion tend to improve. This can take anywhere from a month or two to a year or more for this process to run its course, but it almost always does run its course without the need for any surgery or any invasive procedures. So simple self-diagnostic tool we just talked about. Look at yourself and check your range of motion. Also, be cognizant of when and where the shoulder is painful. Pain up here in the neck tends not to be associated with a frozen shoulder. Pain further down the arm or any numbness in the hand tends not to be associated with a frozen shoulder. The pain tends to be right here in the shoulder, sometimes a little bit down the arm, and it tends to be bothersome at nighttime for patients. When I see patients in a clinical setting, I'll order x-rays and we'll check for other pathologies such as arthritis. Sometimes we'll order an MRI. However, most of the time this is something that is a relatively straightforward diagnosis, again, that you can do on your own, just checking for limited range of motion.
We pause now with 2 minutes left in the video and ask that you open a separate browser screen and go to MoonlightOrtho.com, where you can quickly register for a free patient account and get immediate access to the final portion of this video, including home treatments and remedies, along with any additional treatments that may be prescribed or recommended in office or via telemedicine, including when it may be time to consider surgery. This also gives you full access to the entire OrthoU video library, highlighting all of the most common orthopedic conditions. Once registered on Moonlight Ortho, patients will have an all-inclusive orthopedic telehealth hub at their fingertips and can pay to be seen by a board-certified and fellowship-trained orthopedic surgeon. Moonlight Ortho is the first and only orthopedic-specific telemedicine practice where patients can be seen online by a board-certified orthopedic surgeon. Via telemedicine, patients can receive X-ray, MRI, lab, and physical therapy orders, along with prescription medications, all within 24 to 36 hours from your time of visit. Thank you for watching, and if you enjoyed this video and appreciate the free advice that our surgeons have offered you, please rate and subscribe.